Hello, my name is Dr. Tom Bryant, and I have a chiropractic office in Skokie, Illinois. And I want to explain a little bit about Pedibond, which is a rehab program, mostly what I use to actually try to fix the curves of people's spine and work on the ligaments and muscles. Most doctors that I went to and that I see, and most people, they don't really do a really good, thorough rehab program to actually fix the curve of the spine or fix the curve of the low back. Less than 10% of the doctors do this, that I found out with the studies. And so an example is when a patient comes in, you're supposed to have a nice curve of your neck right here. It's supposed to be about 45 degrees where it belongs, like this, basically shaped like a banana. Now, the lumbar curve here is supposed to be about 35 degrees right here. So when you take x-rays and you actually measure that, you can measure the difference and tell you exactly what it's supposed to look like. So an example would be if somebody comes in and they lost a curve of their neck like this. I see this a lot, and with a lot of patients. So if they do the rehab program, a lot of times you can work on getting the curve back to this way, and you can show pre and post x-rays and show where they got the curve back. Now the NUCA adjustments help with this stuff, but I've never seen where I just adjust their neck or where I just do extremity adjustments or just regular adjustments to fix somebody's curved neck and back like this. You got to work the muscles and you got to work the ligaments. So generally just adjustments are not going to fix these problems. They're not going to fix the structural problems. They can get out of pain and feel better, but if you don't fix the structural problems like this, then they're not going to reach their highest potential of health where they can be. They're not going to be as strong as where they can be. They're just not going to be near as good as where they can be. And I had to do this myself. It took me about 8 months to a year of doing this kind of rehab to fix the curves of my neck and my low back and different things like that. So that's part of the rehab program that we do, and it's very unique. I've had to fly to Seattle a whole bunch of times to actually learn this stuff and to have somebody work with me to do it and to work on showing me how to do it, and been working on it for the last 5 years. There's nobody in the Chicago area that I know of that does it, or anybody really close enough where I could drive to learn how to do it when I did it. So I flew to Seattle, and I go to Canada too to learn from a couple of top doctors that are the top doctors in the world that do it. And so that's kind of what that is. It's basically just working on getting your curves back in your spine, and then working the muscles and working the ligaments to get your body as strong as possible. So